I'm Dr. Chris with Barefoot Rehab and Adhesion Release Methods. I suck at chiropractic adjustments. I have no idea how to use decompression machines or grow a practice with decompression machines. I don't know anything about acupuncture or physical therapy. I don't know any of that. However, I do know how to generate a practice that gets to 200 patients per week, charging $3,600 up front, generating 1.2 million over a year with 3 doctors underneath that practice. So generating $400,000 per doctor. And I'm going to show you the process that I use in order to get there. So I just fleshed out what we did from 2010 to 2023 to get to this model. Now I've made a lot of mistakes. I had a CrossFit gym for 5 years where I just wasted my time in the practice. So there are things that we're doing with our adhesion release methods, doctors and therapists, to allow them to get to a very successful level fast. I started at $45 per treatment. I went to $65 per treatment, went to $85 per treatment, then went to a case fee of $2,500 for 20 treatments in that package. We're at a case fee of $3,600 for 16 treatments, and we treat 200 treatments per week between 3 doctors. So how did I do that? What did I focus on? The most important part by far, as far as getting to a very successful level where you're getting a lot of patients better, you're getting permanent pain relief, you're attracting chronic pain patients who have pain over 6 months, seen at least 3 other doctors or therapists, is feeling adhesion and being able to treat adhesion effectively. By far, it's the most important thing to do when you first start treating patients. This will carry you all the way to the end and even higher as you focus on continuing to get better at feeling adhesion and treating adhesion. If you're not doing that well, we have no business trying to get successful in treating the chronic pain population because it's not going to work. So this is why this is the first thing that happens underneath the $45 per treatment mark, or wherever you're starting your practice or wherever you are now. We need to feel and treat no matter what. In the green here, my suggestion is when you're ready to do a rate increase, you wait until you have a full patient schedule and you have a 2-week wait list. And you're going to do this 2-week wait list every single step along the way. And that's going to be your green light to take the next step, whether that's increasing your rates at a fee per visit or going to a case fee where they pay a large upfront sum for 20 treatments or 6 treatments. So we're going to use the 2-week wait list to make the rate increase or go to case fee. Along the way of feeling and treating, what's key here is that we're generating a referral engine. And that's by getting lots of testimonials and referrals. If we are allowing any patient or client to leave our practice not getting good relief, where they say to people they know, that was another doctor or therapist who did not get me results, in our marketing or our lead funnel, we have holes in the funnel, we're losing people. We need every single person who comes in our funnel, learns about our practice and who we are, to be converted into a successful patient who tells everybody they know, I finally got the permanent pain relief I wanted with that doctor or therapist. That's the purpose of feeling or treating. The outcome is testimonials, referrals. We need this line to get every step along the way towards case fee and get ultimately higher than that. So as we get feeling and treatment, then we're going to start generating leads. We have to know how to tell people that we are adhesion specialists, that we can start helping people who haven't been helped by other doctors or therapists. So that's when somewhere along the way, after feeling and treating, we can start generating more leads. However we want to do that. We use a lot of social media, Instagram, TikTok, Facebook. You can do other things in the office. You can do word of mouth. You can hand out cards to local businesses. It doesn't matter. But we focus on that after we're feeling and treating. Then somewhere as our fees get higher, so around $85 per treatment, maybe a little bit sooner, definitely after feeling and treating, we have to get better with our diagnosing, especially if we're attracting people who have been to at least 2, 3, 5, 10 other doctors or therapists, and our communication needs to be on point. When our report of findings comes, are we telling them that they have disc problems? Are we telling them how bad their adhesion is? Are we telling them that they're overloading their body too much? Are we telling them that they have metabolic issues, that their thyroid isn't helping them, they need to see a functional medicine doctor, that they have emotional trauma from childhood? Are we communicating those pieces? Before we get the case fee, we 1000% need to be diagnosing completely and correctly. and communicating impeccably and with integrity and directly. These pieces have to happen as our rates start increasing and before we get the case fee. Now notice, at about the time when we're at $85 per treatment or a high fee per visit, whatever that is for you, wherever you are in the world, or the time when we're at our initial level of case fee, we can start thinking about an associate. We took on an associate. So we went case fee, I believe, October 2019. We had our best month ever 2 or 3 months after that. I took in $65,000 as a solo doctor therapist in 1 month. And I was like, bingo. I immediately started looking for my first associate because I was like, I have the blueprint, I have the plan, I have the map to get here. Now it's time to teach somebody else how to do this so we can help more people in chronic pain. Looking back, I could see having had an associate at this level. The only problem with attracting an associate at this level is that it's not going to be as attractive to get high level talent because you don't necessarily have that really high level of revenue, because I never had that high. Maybe it was 15,000 at the most before case fee, and then it increased to 64,000 in that month, the third month after going case fee. However, your patients won't expect as high level of standard with why they're coming to see you. So that means there's less stress on you and the doctor you hire to train them to get them to be at your skill level. So if you're here and they're here, there's less stress to get you both to be at this level before you go case fee. So I could see doing it at this point or at this point, but definitely at this point or this point, no sooner than this. This isn't enough income. And if you're this far along, you probably could have done it sooner, because this is going to be really hard and difficult to get another associate doctor or therapist underneath you at your skill level, so your patients can expect to get value from them that they're going to get from you. So this is when we start thinking about an associate. And then about this time is when we're really thinking about business infrastructure. What are our core values, our vision, our mission statement? What's our weekly cadence for accountability with our staff, what we're doing? Are our systems in place? Does everything make sense? Our admins know what they're doing. Our patient advocates who sell our patients know what they're doing. This all has to be in place as we're at the initial level of case fee. Then to get to higher and higher levels, all of these things, feeling and treating, adhesion, lead generation, diagnosis and communicating, business infrastructure, and then of course, massive amounts of testimonies and referrals all have to be put in place to get to this next level. And as I said, Barefoot Rehab in Denville, New Jersey, we are currently at this level. $3,600 case fee, 16 treatments, 200 treatments per week, and we have an 80% success rate, which means 4 out of 5 people who we take on as a patient under a case are successful and happy with the results they get. In order to get to increased levels where people know if they come for care at Barefoot Rehab, they're going to get better, all of these red lines have to keep getting better as we move along that way. So this is the map to, if you want to focus on the chronic pain population non-surgically, get people permanent pain relief and results, get them back to doing the activities they love, have them be super happy with their care, happy they found you, refer everybody they know through adhesion release methods. This is the way to get there. Like I said, I haven't adjusted somebody in years. I don't know anything about decompression. I'm not a functional medicine specialist. We do not specialize in physical therapy or exercises. However, we do focus on people who need chronic pain relief through getting rid of adhesion. So this is what you can do. You can take this map. What are you focusing on? Are you hitting your green light benchmarks in order to get to that next level? And use this to get wherever you need to go so you can help people in chronic pain, because this chronic pain pandemic is a huge deal. We can talk about the opioid and the fentanyl, people dying from these drugs and these substances. So we need more people addressing people in chronic pain, giving them permanent pain relief, and not succumbing to the medical merry-go-round where they become scared and angry and upset. And it's just not fun for everybody. So I'm Dr. Chris with Barefoot Rehab in Denville, New Jersey. DM us, comment, let me know if we can help you or support you in any way.